So you've explained very well why we feel the ways we do when we exercise, but can it be helped? What should somebody do if they are like, hey, I'm a survivor, but my doctor's also telling me that I need movement and I need to walk and movement's good for my brain.
Yeah.
How do you deal with that tension, that balance?
Yeah. I think one thing I want to say, you didn't ask this, but one thing I want to say in the context of this is like keep it simple, start low, go slow. And I think that people, because I try to be active in my newsletter and I try to be active on social media with education, people will misconstrue my saying that you need to exercise with you have to exercise really, really hard. And so I've had people send me messages or people in the comments being like, well, I can't exercise because I have these symptoms. Like, I can't do this because I have those symptoms. If you were in my office and you were in my practice, I would be like, well, then we're not going to do that. We're going to find something that you can do. So keep it really simple. Start low, go slow. One of the places that we start before we even do a test with anyone, before we even find their sense, we talk about symptom limited activity. That's any activity. So if you think about your symptoms, like your overall condition from a scale, 0 to 10 scale. So 0 is no symptoms at all, and 10 is an absolute dumpster fire. If you're like overall, if you're like a 5 out of 10, you can do anything you want as long as you don't get to a 7. Once you get to a 7, that's when you're going to slow down. That's when you're going to change the activity. That's when you stop to take a nap or whatever. But that's one way to start activity, is recognizing that symptom flares aren't indicative of damage. They're not indicative of setbacks. Your brain isn't getting worse. It's just that compensation is kind of fatiguing out and you feel headaches or pressure or there's too much blood flow. So what we want to do is we kind of want to flirt with our symptoms a little bit, similar to the way that we would handle soreness in the gym. You wouldn't expect to go work out and never ever feel sore. Sometimes you get back from the gym and you're like, holy cow, my hamstrings I've never felt them this sore before. We don't want to do that with symptoms where it's residual, but we do want to take you up to that point that you feel symptoms a little bit and then back off. And we call that graded exposure. Basically, we expose you this much and you can tolerate it, cool. Now we're going to expose you this much, and if you can tolerate it, cool. And so we'll bring you up and up and up. And so symptom limited activity is a great place to start. And then after that, it just comes down to finding a practitioner, or there's ways that you can do this from home, but basically finding your exercise tolerance threshold and kind of just staying there and slowly moving the needle. But it comes down to, again, symptom limited activity. And then we talk about sub symptom threshold exercise. So below symptom threshold exercise. So that, again, people who say are worried that exercise is going to be this terrible thing, it's like, no, we're doing it within your threshold and ideally a little bit below that threshold when we're doing actual aerobic activity or resistance training or whatever.
That's excellent. I love that. And so practically, I'll just use a personal example. I would try and go to the gym and do resistance training because for some reason I felt better doing resistance training than like cardio. I think it has something to do with
Mm-hmm.
just the way my vestibular system, my autonomics, I feel more secure, if I'm using the machines and doing weights than just like walking forever. But
Yeah.
if I do it for too long, and that, along with the overstimulation of being in the gym environment, I would get home and be useless the rest of the day. So then I went to the opposite extreme of just like, well, I can't handle the gym. So I just stopped going completely. And so I
Mm-hmm.
had to learn, like, I bought some dumbbells and I had to learn, okay, I can do a little bit at home. And you might take some trial and error, but I love how you described like below symptom threshold. So, and that, it's just a practice and a mindset to get into of
Mm-hmm.
like, if you feel like you're pushing yourself too far, maybe do a little bit less than that.
Yeah. It popped into my head. If you're not familiar, Dr. Nathan Kaiser is in the TBI space, and he'd be a great guy to chat with about your dysautonomia. He's actually teaching a course for clinicians right now on dysautonomia. But he talked about like when COVID first hit and everyone was locked down and the pandemic was new, and we were all just kind of figuring it out from home. His exercise recommendation was like take your phone or take your smartwatch or whatever, your Fitbit, and find your average step counts for the last week. So if over the last week you averaged 3,000 steps per day, what you would try to do is keep a log and say, on Monday, you're going to walk 3,100 steps. And if you tolerated that, the next day you're going to walk 3,200 steps. And so just adding a step per day within that symptom threshold, so making sure that you're not flaring, but just within your tolerance, adding 100 steps per day. The thing that I add to that is try to do it nasal only breathing, because it's going to be this self-limiting piece of, this is going to help build that CO2 tolerance. So it's going to help with that blood flow regulation, but then it's also going to be a limiter. Like, you can only move so fast while breathing through your nose. And so it's a great way to just try to add 100 steps while you're nasal breathing. And that's a really simple way to play with exercise from home.
That's great advice. Thank you. There's a lot of people, myself, my own story, and there I'm sure people listening that have had chronic symptoms for so many years, and they're just now like, well, I haven't been able to exercise for 5 years. Like, where do I even start? So for those people, and, those maybe more of our listeners, because somebody who just had a concussion is probably not listening to a brain injury podcast. They're probably just getting back on the field. Whereas somebody who is having chronic daily symptoms for years and has been having these problems for so long, what's the best course of action for someone who's had chronic brain injury symptoms for so many years? Maybe, like, I never got the Buffalo treadmill test. And I went to PT, I went to vestibular therapy, I went to different things. And so what do you recommend for those people if they want to increase movement?
So that's actually where, so if you're able to get into a concussion provider's office, that treadmill test is where we'll start. It was, like I said earlier, it was originally studied for folks with PCS. And so that's where we'll start. And oftentimes you'll find, similar to an acute case, there's going to be a flare between 50 and 70% of heart rate max. It obviously varies by case and what else is going on, but it doesn't necessarily mean that it's going to take all that much longer. It could just be that was the missing piece you didn't know you were missing. So like for example, I had a rodeo clown who had numerous concussions from the 90s until 2019 when he saw me. He'd felt off for a little over a year. He'd felt off because he'd always, quote unquote, bounced back from his concussions before, when bulls would kick him into fences or different things. But for him, it was 2 weeks. Like, it was 2 weeks before his symptom severity dropped, I think 80, 90%. And he was able to go back to university and tolerate his life again. And at that point, he had done a whole bunch of therapies, but no one had prescribed exercise. And so I don't know if I talked about it in this light, but like when we talked about in the beginning, the mechanism of exercise intolerance causing symptoms, it's the lowest hanging fruit in recovery. If you can't deliver fuel, if you can't move blood appropriately, and you can't deliver oxygen and nutrition, nothing else you do is going to stick as well. And I think that's been people's experience as they go to PT, they go to vestibular therapy, they do vision therapy, neuropsychology, neurooptometry, and no one's prescribed subsymptom aerobic exercise in there. It's like, oh, it worked for a little bit and then my symptoms got worse, or it didn't work at all and I tried this therapy and that worked, but then I kind of regressed. And one of the things we can look at is, well, how's your autonomics? How's your fuel delivery system? How's your recovery system? Are you even able to get restful sleep at night? Or is your foot still on the gas all the time? And so it's, when we talk about PCS, we'll start in the same place. We'll start with that Buffalo concussion treadmill test. We'll start by adding 100 steps per day. One thing that I'll do with PCS folks a little more often than I'll do with acute concussion folks is, with their heart rate monitor, when we're tracking exercise, I'll also have them, I don't know, I think we're allowed to talk about specific apps on here.
Yeah.
I'll have them download an app called Elite HRV. And every morning I'll have them do a morning readiness score. So they put their heart rate strap on and they just sit there for 2 to 3 minutes. And it gives them an autonomic score. So it tells them on a scale kind of how sympathetic or parasympathetic are they. And what was their heart rate variability compared to their resting heart rate. And so that's one thing we can do, is we can track that morning readiness so that we can see, is my rehab tanking this person? Like, when we introduce this exercise, does their heart rate variability just drop to the floor? Or does it kind of stay stable and possibly increase in the direction that we want it to? And so that's what we'll do with PCS folks, is we'll start with the Buffalo concussion treadmill test, but I'll also throw in the extra of, hey, let's monitor your recovery to make sure that you're tolerating this well, because you've been dealing with this for years. Like, I don't want to put the straw on the camel's back that sets you into symptoms for the next 2 weeks. Like, I want to make sure that you're tolerating this.
So generally, you're recommending to start lower and increase over time. Now, what are some practical tips for someone who wants to increase movement? I've heard people talk about yoga or chair yoga, or I've heard people talk about different things they can do at home. Do you recommend walking? Like, what types of ways, if somebody's like, okay, where do I even start increasing movement? Maybe they haven't been able to exercise for over 5 years, and so they're not in a routine. They don't even know where to begin.
So for folks who haven't been able to exercise or haven't known that they were able to exercise, the big thing that I would absolutely keep in mind is sometimes, so one of the things that I've seen is when folks find out they can exercise, they'll overdo it. So keep in mind the symptom limited activity metric of not increasing symptoms more than 2 points on that 10-point scale. And also consider that, like, within the context of movement, in terms of your general health, like beyond concussion, something and anything is going to be better than nothing. So keep in mind that 2 point scale of symptom tolerance. But then if you have notable vestibular symptoms, like when you move your head, you get really dizzy, or when you get up and down out of bed, you get really dizzy, try to limit it to more stationary activities. So maybe you can get access to, like, my wife and I have a cheap, it's not a Peloton by any means, but we have a cheap little stationary bike that we both use, and we'll ride for 20 minutes while we're watching TV. So something that is not going to have too many vestibular symptoms. So a stationary bike's a good example. Say you have minimal vestibular symptoms, but you can tolerate it. Maybe add that 100 steps to your walk around your neighborhood, or to your walk with your noisy daughter, or simple things like that. If you can tolerate, so you don't have any vestibular symptoms. I like yoga for the proprioceptive and balance aspects of it, or kind of the meditative focus on breathing. Really, really any movement is going to be better than none. One of the apps that I really like as your tolerance starts to improve is Nike Training Club. So Nike Training Club is going to be resistance training. Some of the workouts are going to be higher intensity, but they have within the app, they have yoga, they have body weight exercise. And that can be a nice way, I think you can access well over 100 workouts without actually buying anything in the app. So that's why I like recommending it for folks. This is a nice free thing. But really just any way to get moving, but keep in mind that symptom limited activity. Your best bet, at least from what we know in the research, your best bet for getting kind of over the concussion hill, over the PCS hill, and getting more towards normal activity is finding out what your autonomic threshold is, what that exercise threshold is, and then getting as close to or above that 80% as you can, as consistently as you can. So just starting out, anything is better than nothing within that symptom limited threshold. And then to really, really gun it and make progress, like pick up a heart rate monitor, crunch some numbers, find out your percentage of heart rate max. And then what we do is we'll increase 5-10% of that heart rate max every few days that you can tolerate. So if you can tolerate 2-3 days in a row at 50% of your heart rate max, the next couple of days, try 55%. And if you can tolerate that for a few days, try 60%. And if you can tolerate that, just keep, slowly working your way up. It can be much easier to be guided by a concussion provider, but if you don't have access to one, or you don't have access to that, adding 100 steps, adding 5% to your heart rate max, really simple ways to just keep moving that needle forward.
Through your darkest night, hope survives.